I'm talking with Ali from Norwell Healthcare Services, and we've been talking about caregivers and the things they have to go through, and a lot of pressure, a lot of work, and what goes on there with home health care. So I'm curious, how does the caregiver and the home health aide work together? What's that working relationship, right? And how do they get it working for the loved one of the caretaker?
Well, one of the things that you really want, and one of the things that I mentioned earlier, is really feel confident in the person that's taking care of your loved one. It's already, a strain on your emotions and whatever you feel like, you may be going through when it comes to the fact that you're not able to do it.
Yeah.
And so you want to make sure that you got somebody that at least professionally can do the work that needs to be done. And you would hope that when you see these people, they have the compassion.
Yeah, sure.
I don't know. You've seen a lot of the videos. You've heard a lot of things.
Yeah, sure. I mean, it can seem like it's not always so good out there.
Yeah, right. And that's a thing. And so the first impressions is expectations, for one. First of all, it's something that needs to be evaluated. And what's expected from a caregiver when they're coming in and doing the work that needs to be done. We're not glorified babysitters. We're not maids. We're not transportation. And that kind of thing. We're here as a part of the healthcare profession to be able to make sure that your loved one can stay at home and live effectively for that particular day or that time that we're there. And so with that, I always tell my aides, watch how you show up, and you have pride in what you do. That shows when you walk through the door.
Yeah.
It doesn't matter about whatever's going on, because that's life. Things happen.
Yeah.
We encourage people not to get into their creed of living or their opinions about life. You're there to help make sure that these people get taken care of. And you may find a friend there, and that's awesome. Yeah. But friendship can't supersede good health. You know what I mean? It just can't. You can't be ganging up on the old guy because